Good afternoon, everybody, and welcome to the webinar. Today, we are in our mental health and CBD series. We are in the fourth webinar of the month, looking at all different aspects of mental health and cardiovascular disease and why both of them kind of play off of each other and why it's so important to understand. Today's webinar is on the topic of mood disorders associated with heart events. Before we get started, I just want to give a couple of bits of information to make your listening a little more enjoyable. All attendees are in listen-only mode. If you cannot hear, hopefully you can read my slide and you can check the audio button on your personal computer to assure the sound is on. That's typically the problem that we see. During the presentation, please type your questions into the Q&A box at any time. You don't have to wait for the end to type in your question. You can ask it or you can type it in anytime during the presentation because we will read that questions out during the Q&A period and they'll just be in there and it's a little easier to do it that way. The PDF version of the slides as well as a recording of this presentation will be available on the Mended Hearts website following the event. And all of the handouts that we have will be available in the handout section on the website, but also Leslie will be putting those into the chat box today. So if you're not familiar with Mended Hearts, we are a nonprofit community based here in the United States, and we have 20 countries that we are covering now. And our mission is to inspire hope and improve the quality of life of heart patients and their families through ongoing peer-to-peer support, education, and advocacy. And today, I'm very excited to introduce our speaker, Dr. Karl Ullrich. He is a board certified in trauma and is a fellow American Psychotherapy Association and is a member of Mended Hearts. He's a survivor of sudden cardiac arrest, and he is a member in Chapter 341. So we're so very excited to have you with us today. And I am going to turn the presentation piece over to you, and I will work your slides, and I'll be right here for you.
Okay, thank you. To start off with, this program, the purpose of it is not intended to be a psychotherapeutic in nature. If anything comes up from that stirs within you after listening to this and seeing this program, you need to contact your healthcare professional. To start off with, this whole idea of the connection between heart and brain or heart and head goes back to 1628 and a British physician by the name of William Harvey. And he wrote the following: a mental disturbance provoking pain, excessive joy, hope, or anxiety extends to the heart, where it affects temper. This is sort of flowery said, but essentially, hopefully you'll see the connection between heart and head. A cardiologist by the name of Danielle Hinkle, Lowell Indian University, says it's common for people to survive cardiac event, a procedure to struggle with mental health thereafter. 1 in 5 will develop a serious form of depression, while 1 in 3 will come away from the experience with anxiety. An enduring somatic threat is a gift that keeps on giving. While most traumatic events are singular, such as a traffic accident, where once the wreckage is cleared, the event, the residual of the event will sort of peter out. In a cardiac event, unfortunately, it's an enduring event with reminders such as doctor's appointments and medication. While most do not think of coronary events in the same way as war or criminal acts, they are nevertheless the fulcrum event that can become post-traumatic stress disorder. We've heard plenty about PTSD over the years, probably more than we want to know coming out of Vietnam and later military conflicts. And then, of course, that's been broadened to include things like natural disasters. Well, unfortunately, cardiac people, it's ours too. While most do not think of these things as being important, about 40% of the cardiac patients report an event, a major impact in their lives. This is just going to the emergency room, just that much. These feelings can manifest themselves in subsequent diagnosis of depression and anxiety, and that's what we're going to be talking about chiefly today. Motor function, language, complex attention deficit, social cognition, learning, and memory can all be affected by coronary events, either directly or through biological pathways, or indirectly through risky health behavior. The physiological factors contribute to the conditions that result in a heart attack and stroke, while the behavioral factors, things over which we can exert control, lead to the psychological conditions. When we're not consciously directing our attention to a specific task or activity, the brain clicks into what's called the distinctive neural pattern called the default mode network, or DMN, as medical people are wont to do, put letters to things. This is a state of wandering, a distracted brain activity wherein our attention is lurching compulsively from thought to thought as they rise to consciousness. Interfering with this is hypoxia, the condition in which there is a decrease in the oxygen to the brain. Afterward, the critical event, adverse critical event comes out. You start to create new memories. After reoxygenation, memory recall recovers faster than memory formation. What that means is that you're going to be able to recall things I do 50 years ago, and I'm 80 years old, so that's a long time. But I can remember things very specifically, and yet I may not be able to recall something that happened yesterday. Both cognitive impairment and cardiovascular diseases have high incidence of elderly population, increasing the burden of care and reducing the quality of life. Added to the aforementioned factors are hormones, such as cortisol, released into the bloodstream when the brain is confronted with a fight, flight, or freeze situation. This may be the way blood clots are formed, setting the stage for a heart attack or a stroke. Of those hospitalized following a heart failure, the acute myocardial infarction, 64% were readmitted after 15 days of discharge. Moods and behavioral patterns impact our chemistry in ways that are toxic to the brain. And that's where we're going to get into now, anxiety. When you're anxious, the body activates stress response, causing blood to move around the body so that more of it can be sent to the parts of the body vital for survival, which includes the brain and the extremities. There are two types of anxiety. One is called trait anxiety, which is stable and persistent and affecting how a person thinks in the long term. State anxiety is temporary, State anxiety is temporary, occurring in response to or anticipation of stressful situations. For a cardiac patient, this could be the anticipation of a cardiologist appointment to hear the results of an echocardiogram, for example. These differences in how the brain processes information may make some people more likely than others to perceive certain things that are dangerous. Hearing a siren on a passing fire truck may stir anxious feelings, recalling the ride in an ambulance to the emergency room. Physical symptoms of psychological anxiety include palpitation, anger, abnormal heartbeat, and muscle tension, and redness of face. This happens more often with women than it does with men. I have no reason to, or I can't tell you why that is so, but that seems to be the case. In men, elevated anxiety is associated with low physical activity, high rate of cigarette smoking, depression, high levels of alcohol consumption, and high blood pressure. Now that all sounds familiar. It sounds like a guy thing. And it is one of those things that if we don't pay attention to those things over which we have control, then we're really going to be at the mercy of those things over which we do not. Lowering your level of anxiety occurs in a lower heart rate, blood pressure, lower blood pressure. Now, finding a way to do this is not easy, and it's not a one-size-fits-all thing. If you come up to the slide number 20.
Sorry, I think I got behind.
That's all right. Go up to 20.
How's that? Good? Anxiety?
No, yeah, that's well, let's see. What I'm looking for is the one after this, one more. There you go. Okay.
All right, sorry.
That's okay. The idea of turning down the volume on anxiety is that anxiety is something we deal with all the time. It's not, like depression, but depression is really driven by some particular event. Anxiety can happen, as I say, if you're happen to be in a place and an ambulance comes by with a siren, that can create anxiety. We'll talk about more of those things that will stimulate. But the important thing is to find a mechanism, something that will help you with controlling the anxiety. Now, these are some things that are fairly common to folks. The Tai Chi, breath control. I've done Tai Chi. I tried yoga. It wasn't quite for me. Breath control is something I do all the time, and meditation is also another factor. I do have some programs. Maybe later we can get into stress control and other ways of dealing with anxiety. Diaphragmatic breathing is an easy technique. Now, this may sound like a little over the edge, but if you try it, and it's actually I found it in all of these things like yoga and Tai Chi and whatnot. Breath control or breathing properly is very, very important. So this is just a quick thing, but the idea is if you put your hand on your abdomen or on your belly and one hand on your chest, you want to breathe into your abdomen. So you want your belly to rise while you're inhaling. And then on your exhale, you'll feel your belly go down, but you want to inhale, take about 5 seconds to do that. And then to exhale, you want to slowly do that. You want to take about 10 seconds to do that. So you should be able to take about 4, maybe 5 breaths a minute in order to accomplish this. So I offer it to you as a very easy way. You don't need to buy a gi, and you don't need to go out and learn any cute steps or anything. This is a very easy way to reduce your anxiety, which of course what you're doing is actually reducing your blood pressure and your heart rate. Good things. Okay, up to 33% of the heart attack patients end up developing some degree of depression. So we're going to turn the corner now and go into the dark side of this. Following the cardio event, most are concerned about their physical well-being, ignoring the mental and emotional toll heart disease takes. And all these quotes that I'm giving you are from papers that have been written actually over the last 10 years addressing this very subject. Depression is an important disorder that leads to an increase in cardiovascular hospital readmissions. Among patients hospitalized with myocardial infarction, heart attack, major depression has been shown to be associated with a 2 to 4-fold increase in cardiac mortality. Up to 2/3 of the patients with myocardial infarctions develop depression. Now, so much for the facts. The important thing is you have a heart event of some kind, and whether it's an actual heart attack or whether it's a valve replacement or a stent, whatever it is, it's really going to change your life, because you realize how close, once your heart stops beating, you're pretty much done for. So the idea of being able to survive that and come away without depression is remarkable. So if you are able to control the depression and get a handle on that right away, right out of the hospital, then you're going to be able to increase your chances of not being readmitted for the same or similar thing. A number of factors may place someone at higher risk for developing mental health struggles after a cardiac event or procedure, including the pre-existing history of anxiety, depression, or prior trauma, living under a financial strain or social economic stress. So the stress that you have is just only going to be compounded by your cardiac event. You've already got the normal living stress that we all live under. So add to that the cardiac stress, and you can see you're going to push yourself over the top. Male patients with depression usually have lower physical activity, as we mentioned before, higher rate of cigarette smoking, higher levels of alcohol consumption. Physically active women, however, have the lower risk of depression and cognitive decline. Hooray for the girls. Seldom considered as a mental health factor, a cardiac event, cardiac-related depression and anxiety activity relate to medications. So we don't think of it as a bad thing to take medications. You're supposed to take your medications. However, when you do, in my case, I take them morning and night, I'm constantly reminded about what happened to me in June of 2019 when I was sitting in a restaurant and having dinner with my wife, and suddenly the world came to an end. That's a shocking thing that you don't forget. Several reliable and valuable instruments have been developed to assess depression. The whole thing of depression, when you get into it, being a psychologist, that's one of the things that most psychologists deal with more often than anything else. But there's something called the Beck Depression Inventory. Dr. Beck developed this. It's been around a long time, but it's still considered one of the best indicators of your level of depression. And it's a patient-administered instrument. It's something you can actually download online yourself and take and evaluate for yourself. In post-cardiac event period, most often for the life of the patient, medications will need to be taken. Each time you do this, it's going to be a reminder of the near-death experience that you had. But the important thing is you have to take the medications. What happens when people realize that the medications are causing them to be re-experiencing this event, then they will stop taking them. They'll do it with the feeling that they're not going to feel depressed if they don't take the medications. Well, of course, they may not feel depressed, but they also may die from not taking the medication. Okay, now moving on with anger and hostility. Now, this is an area of anxiety that is not necessarily connected. People don't think about anger and anxiousness as being part of the same token, but in fact it is. Hostility and the reactions to post-event stress, one of the things is called intermittent explosive disorder. Now, like so many other things, I have personal experience with this. We have a dog who's a hunting dog. We inherited him. I think we're the third family that's had him. In any case, like a hunting dog, he howls very, very loudly, and anything that comes on his property, he gets really upset about, like the UPS guy, for example. So Charlie's sitting next to me, and all of a sudden the UPS driver pulls up, and Charlie lets out with a howl that will cause your hair to stand up on end. And my reaction to that is to discipline Charlie with a few choice words, and thank goodness he doesn't understand English, so he doesn't know what I said to him. But I wasn't real happy. You can bet that. And that happens. When that happens, what happens is the release of steroids into your bloodstream, catecholamines and glucocorticols, all are dumped into your system because of the fight or flight reaction to this howling in my particular case. But it could be anything that that would disrupt your peace at the moment. Episodes of anger are associated with higher risk of myocardial infarction, acute coronary syndrome, ischemic and hemorrhagic stroke, and arrhythmia. Young men who frequently become angry under stress have an increased rate of developing heart disease before the age of 55. That's a sobering statistic. Intermittent explosive disorder is the impulse and impulse control disorder characterized by repeated angry outbursts. And it's very easy to lose your temper, I have found out after experiencing this. Now, moving on from anger, let's move into what's called social isolation. It's not generally thought of as a factor of cardiovascular disease. However, life after a heart attack, valve replacement, or other procedure can impact your social life. You may no longer be able to work. When I developed or found out that I had arrhythmia, atrial fibrillation, I had to retire. At the time, I was in law enforcement, and I could no longer run the streets, so I had to retire. And thank goodness I had enough time to retire. So, so the idea of anger now morphing into these explosive disorders, and then ultimately into social isolation, means that you're not going to have this. In the fact that when I retired, all of my friends that were in law enforcement, I really never saw them again. So I had to make new friends, and that's not easy to do. If you can move into a social network of some kind, you're going to have an opportunity to improve your health, not only your emotional health, but your physical health as well. I live on an island off the coast of Georgia, and so for whatever reason, paddle tennis seems to be quite popular. And so I drive by these courts, and I see these people out there playing paddle tennis. That's not a hard, doesn't seem to be a sort of thing that really requires a lot of exertion, but it has two factors. One, it does give you physical exercise. You are out there swinging your arms and running around the court a little bit. But the other thing is it gives you social contact with people, and that's important because it's very easy to start finding yourself sitting in that comfortable chair, excuse me, and not getting out into the world. So you need to look for ways to socialize, and you need to do that as soon after you're discharged from the hospital as possible. Support groups are good. And that's what Mended Hearts is about. Support, peer support, people that have been through the same thing you've been through. Sometimes they're ahead of you in the recovery process or the rehab process. And there are others that are behind you that you're going to be able to help. But one of the things that you can look forward to as a help is to find ways of volunteering to help people, provide some service. And it doesn't have to be, something that you're going to do 8-10 hours a day. You need to make sure you're just spending a reasonable amount of time commitment to helping others. I had the chance today to help a lady across the parking lot just to walk with her because she was afraid of the cars weren't going to stop for her. And I said, well, they'll stop for me, because if they hit me, I'm going to really put a dent in their car. So, but I mean, that was like, once I got to the sidewalk, she thanked me and I was on my way. But A, it made me feel good to be able to do that for her. And B, it probably took a little off her mind of whether she's going to make it to the curb or not. Okay, now let's try to sum up everything in a short go here. Default mode network plays a role in conscious thought, social cognition, processing emotions, and memory retrieval. These are things that are going to be impacted by the fact that, remember, we mentioned hypoxia and anoxia is the other one. One is total lack of oxygen, the other is a reduced amount of oxygen. But the important thing is that after 5 minutes without oxygen, brain cells die. I was on the floor for a while. I was fortunate there was a dentist who had just completed his recertification for CPR. And he jumped right in there and started jumping up and down on my chest and kept me going until the paramedics got there. And then they shocked me a few times and finally got things working. But the idea is that you need to be aware that there's going to be losses concerning any kind of reduced oxygenation to the brain. All right, post-traumatic stress. Symptoms include unique psychological responses to surviving a life-threatening illness. And you could say life-threatening experience, which could be a traffic accident, or it could be something at work, or it could be a natural disaster, or certainly, of course, military. Chronic stress exposes your body to unhealthy, persistent levels of stress hormones like cortisol. Remember, we mentioned that when you amp up, when you stress out, you're going to get a dump of all these into your system, and it's going to take a while for them to bleed out. I mean, not bleed out, to reduce, because they're going to have to go through the kidneys and get washed out, and so in the circulatory system, they're going to be there for a little while. Trait anxiety, we mentioned that. Excuse me, I mentioned that. Occurs in response to anticipation of a stressful event. So simply saying, I've got to go to the cardiologist. I've got to have my pacemaker checked, or whatever the appointment is about, is going to cause you to feel some stress, and that, as I said, is going to dump the chemicals into your system. PTSD and depression often co-occur, and both have been associated with medication non-adherence. And I mentioned this, you have to take the meds, even though you may feel a little anxious about it afterwards, because it's reminding you of something bad that happened to you. You still have to take them. Anger and hostility increase. The risk worsens for heart attacks and likelihood of the intermittent explosive disorder. These things can be in the stress program. I talk a lot about the pharmacology involved in this, and some of these things can be helped with medications, but medications are a short-term solution to anything regarding your behavior and your mental health. You really need to get involved with either a group therapy group or with a psychotherapist individually to resolve the issues that you have. Okay, I think that's probably where we are. Got through that faster than I thought. So, any questions?
Thank you so much. Lots of great information there. I was particularly interested in the post-traumatic stress disorder because I feel like we know that it occurs, but there's not a lot of studies done on people with chronic illness versus somebody who was through one specific life-altering event and then moved on. So thank you for covering that. I think it's really important. I have a couple of questions, and then I just want everybody to know, if you have questions, please type it into your Q&A box and I will read them out. So this first one is, how long does it take for our cortisol levels to get back to normal after an event?
Okay, that's a very good question. And the answer is fairly good. Not terribly long. I'm saying probably, and again, it's how much is being dumped in. So if you have a really difficult event that you're trying to that you're reacting to. Let's say it's a very short-term event. Looks like somebody's going to not stop at that stop sign, and they're going to T-bone you at an intersection. That's going to shoot your steroids up, but it's not going to last very long, and so they're not going to dump a whole lot into your system. So in a case like that, I would say you're probably looking at somewhere 5 to 15 minutes that it'll start to flush out of your system. For a longer event, for something that you're really going to be thinking about and stressing about over a longer period of time, I think you're probably looking at somewhere between 15 and 30, maybe 45 minutes before it can wash out of your system. I wouldn't go to the bank on that, but those are fairly close, I think, to what you'll find.
Great. So this next question is, can you speak to the connection between heart events and insomnia?
Yes, I can. Insomnia is, well, without getting into the technical definition of insomnia, but unable to get to sleep is a problem. And again, in other words, you're listening to somebody that's experienced it. And what I have found is that a lot depends upon what you do before you go to bed. So I try to be very careful about from 6:30 on, and I'm a pretty early retire. I retire about 10 o'clock almost every evening. Excuse me. So I think it's careful about what you eat, particularly anything that's going to have sugar in it. I like an apple with a little peanut butter on it, or half an apple with peanut butter on it. It's kind of my favorite snack about 8:30 or so. But you want to be careful about that. And then the other thing is you want to get your mind to kind of slow down. And I notice there are a lot of things on the market now, and of course, they're all being advertised by people that are in their 70s for the most part, whether they're actors or whether they are personalities, try as football players or whatever. But the idea is you want to get your brain to slow down. I found that gabapentin works pretty well for me. It's an over-the-counter, and I take the gummies. I just put one of those gummies in my mouth, and I found that it really has worked very well. There's melatonin is another one. The brain. These are both chemicals that are found in the brain. So all you're doing is kind of giving the brain a little boost of those chemicals. And I found that melatonin, and I'll take one of those at night too. And they're in various levels, so you want to be careful. And the thing about melatonin is your brain will become accustomed to it. So after a while, excuse me, you have to increase the amount of melatonin for it to have the same effect. So my favorite person is my pharmacist. I mean, I like my cardiologist, and my RP, and then my general practitioner. But quite frankly, I look to my pharmacist for advice on anything that I take or any combination of things, particularly anything that's over the counter.
Great. Yeah. Yeah. And we always want to make sure we're talking to our doctors and medical professionals about those types of things anyways. But I agree that I think that sleep issues are probably due to a lot of times the stress and anxiety that we feel after the cardiac events, right? Like I think that kind of goes hand in hand because of the stress and anxiety. And I know even as a caregiver for my son, that stress and anxiety also tends to lead me to be having insomnia as well. So it's not just heart patients. So I have two more questions. One here is about caregivers. It says, how do I deal with anger from a loved one after a heart event? Is there anything that I can do as a caregiver to diffuse the situation?
Okay, I'm not sure whether is it the caregiver that's experiencing the explosive events,
No,
or is it
the patient is
the patient?
experiencing the anger, and the caregiver is asking how, is there anything they can do to help the situation and diffuse it?
Well, yes. I'll use my own experience with this. My wife pointed out to me, whoops, something I did there. Whoops, get rid of that. My wife pointed out to me when I was having these explosive disorders, these explosive events. That's the whole thing is a disorder, and I, because I didn't realize it at first. I mean, and that I think is probably a case across the board. You react so quickly to the event that, excuse me, you don't realize that what you've done and what you've said. And then the second part of that is you're embarrassed. I yell at my dog, or I smack him on the butt or whatever. And it's a 60-pound hunting dog, so he doesn't take the abuse lightly. So anyway, the idea is, I think the individual, the patient, if you will, or the care receiver, I'd rather use that term. The care receiver, I don't think, recognizes what they've done and the impact it's having on the caregiver as well as others around them. So I think that if you have a good relationship with the care receiver and they're able to listen to you, that they need to understand that, they need to recognize it. This may be very difficult depending on your relationship with the care receiver. If that is someone with whom you would have a difficult time making this point, then you may want to look for somebody else. Maybe if you're a religious person, you might want to try your pastor or whoever. The other thing would be to find a group that the person would fit into, like a Men at Heart's group, where these topics are discussed, and they can be made aware that they're not the only ones that feel this way. And I think that's another important factor. Once they realize that they are giving off of these explosive events, they're not alone. This is very common in the recovery process.
Great. So the next question, I think we probably don't have a great answer to, but Laura says, our Kaiser has support groups for Alzheimer's, breast cancer, but not for heart problems. What can we do to bring this group into their therapy regimen? Laura, I think you should talk to Mandy, and you guys can try to work on get a Men at Hearts into Kaiser where you are. But overall, I think the idea of support groups for people like with breast cancer patients is a prime example. Alcoholics Anonymous. I mean, people know that this works. It's just a matter of how do we get our name and get our organization into these into the hospitals for them to offer this support network to patients. So it's a lot of, I think, on the ground work that needs to be done for people to recognize how important that peer support aspect is. Do you agree, Doc?
Yes, I do. And the other thing that you have to keep in mind, I am this is called a resource person for support group for Parkinson's caregivers and also for Alzheimer's caregivers. I don't have anything to do with the care receivers, if you will. Excuse me, that's out of my ballpark. But I have developed several programs in what's called compassion fatigue, and work with these groups in that way. So, pardon me, I don't want my throat dry. The thing with the hospitals, though, is remember, we kind of think of hospitals, like we do about a church. We say, well, they're very nice people, and they're absolutely necessary in your society, but they're really, while they may be nonprofit or not for profit, like most churches are. Well, all churches are, I guess. they have to turn a dollar. They have to make money. So giving services away that's going to cost them money and they're not going to get anything back from it is difficult to talk them into doing. I found at my hospital that if I can get people that are in the therapy end right now, they're in the rehab end, not the therapy, the rehab end of their endeavor, and bring them together maybe once a month for a support group and a presentation. That probably works well. It doesn't cost the hospital anything, and it gives them a lot of community goodwill.
Yeah, the hospital's anything to have a mended heart. So that's great. Okay, so the next question is, how do thyroid problems, Hashimoto's, affect mental health when you also have heart issues that are causing the mental health problems? So does thyroid issues play a role when you're dealing with heart issues and the thyroid issues?
I've got to be quick to tell you this is out of my ballpark. I am not familiar with and haven't really done any research where thyroid issues are involved. So I really have no answer for you on that. I would suspect, and again, this is just kind of off the top of my head, I would suspect that yes, that any other disease or condition that you add to the coronary panoply of distress is going to affect it in a negative way. If that means anything to you. So yeah, I think you need to look to somebody that's a mental health professional that's got more experience in that particular area than I do.
Yeah, great. Thank you for answering that. So the last question I have in my queue, I'm going to ask, and then if anybody has any more questions, please feel free to put them into the Q&A section. But this last question, and this is one we've received a lot of times over the course of this last month. And so maybe you have some ideas. This is advice for finding a therapist who will be helpful for depression following a heart event. The question says they're having a hard time finding good psychotherapists who will take Medicare. So do you know where you go to find a good therapist?
Oh, well, no. The short answer is no. I don't have a list or even a good referral for this. Here's the reason why. Cardiopsychotherapy is a field that has been around probably for the last 40, 50 years. There was some research done about 50 years ago. Excuse me, that started this whole thing about looking at cardiac conditions from the mental health side and recognizing that there's a connection to it. So finding what you want to do is get online and see if you can find some cardiopsychologist or psychocardiologist. Either way, there is no national organization I haven't been able to find, but there are some hospitals that have both mental health professionals and medical professionals working jointly on this subject. So I think looking around online, you'll probably be able to find something that will at least give you a lead into something else.
Great. Well, thank you so very much. We really appreciate your time today talking about this topic. And for everybody watching, thank you for joining us this month on our mental health and cardiovascular disease series. We hope that we are going to be bringing together a lot more resources for everyone on this topic. And Dr. Karl, thank you so much for spending your time with us. We really appreciate your expertise. And with that, if nobody has any more questions, I think that I will say goodbye. And thank you so much.
You're welcome.
Have a great day.
Bye-bye.
Bye-bye.